Hello, my name is Darren Gaines, and I will be presenting on the negative consequences of climate change on human health. I chose this topic because I'm interested in how increasing global temperatures will negatively affect the health of the human population in different aspects over time. How does climate change impact society? Well, according to a comprehensive assessment on the impacts of climate change on global health conducted in the United States, climate change exacerbates sensitive health threats by creating new economic and healthcare challenges while exposing a greater percentage of people in a larger portion of regions across the country to extreme weather and climate conditions. These changes in climate conditions ultimately affect human health by increasing exposure to heat waves, floods, droughts, and other extreme events. In addition, it increases the spread of all communicable diseases such as vector-borne infectious diseases, food-borne infectious diseases, and waterborne infectious diseases. It alters the quality and safety of food, water, and air throughout the globe. In addition, the mental health and well-being of individuals is exposed to a greater risk. Extreme events such as droughts, wildfires, heavy rainfall, floods, storms, and storm surges have steadily increased over the last century due to the changes in our climate. They have become more frequent and more intense each decade and each time they occur. As a result, these extreme events have affected the population health by exacerbating underlying medical conditions, increased stress, and led to adverse medical health conditions in individuals. In addition, extreme events have disrupted public healthcare systems in ways that affect the healthcare in that region long term after the event has occurred. An example of the effects of an extreme event on the population can be observed from a severe drought that occurred in California nearly 5 years ago. In 2015, California was in their fourth year of a severe drought, the worst drought the state has ever seen since becoming a state in the 1800s. A range of drought-related illnesses were observed in the two households of two counties, Tulare and Mariposa. These households reported an increase in dust, leading to allergies, asthma, and other respiratory issues that diminished the peace of mind of these individuals. These dry conditions increased the reproduction of a disease known as valley fever that developed within the dry soil. Symptoms were persistent with the flu, but they occurred for months and resulted in a 40% hospitalization rate. Hospital admissions and deaths from valley fever was dependent on the drought severity of each county. Higher temperatures contributed to climate change are linked to an increased risk of a range of illnesses and heat-related deaths. Older adults, pregnant women, and children are at increased risk to suffer from these heat-related illnesses or death. Urban areas are also at higher risk due to additional sources of heat associated with industrial facilities within those regions. As temperatures have slowly increased over time, so have heat-related deaths. An analysis of hospital admissions, emergency room visits, and emergency medical service calls show that hot days are associated with an increase in heat-related illnesses, including cardiovascular and respiratory complications, renal failure, electrolyte imbalance, kidney stones, negative impacts on fetal health, and an increased number of preterm births. These numbers increase as a result of increased temperatures. Climate change also affects our water sources and results in an increase in water-related illnesses and deaths. Increasing water temperatures associated with climate change are projected to alter the growing season and the geographic range of normal algae and pathogens. Harmful allergies and pathogens. More frequent and intense rainfall is projected to increase the contamination of recreational waters and drinking water sources with pathogens and toxic algae. Increased rainfall leading to the flooding has been linked to an increase in gastrointestinal diseases that cause diarrhea and can increase other bacterial and parasitic infection exposures. As a result, contamination of water and flooding will ultimately be a source of spreading a wider variety of bacteria and parasitic infections across a greater portion of the world. Climate change can adversely affect global and United States food security by threatening food safety, disrupting food availability, decreasing access to food, and increasing food prices. Food quality is expected to suffer as rising carbon dioxide concentrations increase, and this will ultimately decrease the dietary iron, zinc, and protein within crops and seafood. Exposure to short-term weather-related events such as a hurricane or tornado, or prolonged events such as a drought, can cause negative mental health consequences. As the number of extreme weather events have increased, it has resulted in an increased number of people who have suffered from mental health conditions such as stress, anxiety, depression, post-traumatic stress disorder, or suicide. These issues can come about from experiencing the event itself or living through the aftermath of the event in which someone might have to deal with losing a loved one or losing their house. Individuals who are at increased risk for experiencing mental health issues during these events include the elderly, pregnant women, and those who have existing mental health conditions. In addition, higher temperatures have contributed to an increase in aggressive behavior such as suicide and homicide. Many solutions have been proposed to minimize the effects of climate change and ultimately slow the changes in our climate globally. In the meantime, many cities and states have begun implementing adaptations to minimize the health risks of climate change to their citizens. At the state level, adaptation efforts have included conducting vulnerability and adaptation assessments, developing comprehensive response plans to extreme events, climate-proofing healthcare infrastructures to withstand the natural effects and healthcare effects of an event. In addition, they have implemented integrated surveillance of climate-sensitive infectious diseases to prevent and slow the spread of diseases, and implemented policies to reduce greenhouse gas emissions. From a local level, adaptation efforts have included altering urban designs to help prevent the emission of carbon dioxide into the atmosphere, and improving water management systems to help stop and control the spread of infectious diseases in times of floods and heavy rainfall. In addition, many cities and states have attempted to manage heat-related mortality by inserting protective measures such as early heat warnings, air conditioning, cooling shelters, green spaces in neighborhoods, and resilient power grids to avoid power outages during extreme weather events. All of these actions or implementations have been put into place to help slow the effects of climate change or alter the effects of climate change on the human population. The maps show estimated changes in annual net mortality due to extremely hot and cold days in 49 United States cities for 2080 to 2099 as compared to 1989 to 2000. Across these cities, the changes in mortality is projected to be an additional 3,900 deaths each year under a high scenario, pictured on the right, and 3,900 deaths each year under a low scenario, pictured on the left. All information was obtained from the 4th National Climate Assessment, Chapter 14 of Human Health. I hope you enjoyed watching this presentation and learned something about the effects of climate change on human health.